1980s, after decades of conflict left Vietnam in ruins, a massive political, economic, and social overhaul known as đổi mới ushered in greater opportunities for private investment and a loosening of the previously centrally controlled economy. This began an explosion of commerce, a rapid increase in gross domestic product, and a greater reliance on the private sector as an engine of growth. These changes had unintended side effects, among them a decline in an already basic low quality of healthcare for poor and rural Vietnamese. By 1998, the Vietnamese government was spending less than 1% of its budget on healthcare, compared to 37% in China and 14% in Thailand. With depleted budgets, the commune health centers were unable to pay for basic equipment, medicine, training, or maintenance, which the rural poor relied on. Higher education faced similar challenges, with crumbling infrastructure and an outdated system of learning in provincial and regional universities. In 1998, Chuck Feeney visited Vietnam for the first time. He was greatly moved by what he saw and felt an obligation to do what he could to help.
The world is full of a lot of people who have less than they need, and each time you can address their problem, you help them to move forward and to feel that, all right, the life can change and I can change it.
By working locally, regionally, and nationally, Atlantic began to help transform Vietnam's higher education and healthcare system.
We're still an NGO working in a very large country of 90 million people. And so the most that we can do is to show that, to establish a model that address a problem, an interventional model, to show that it can be addressed and it can work. And hoping that, that others will follow our lead, specifically the government.
Early grants went to both hospitals and universities, with the majority of grant-making between 1998 and 2005 focused on higher education. The largest and most dramatic Atlantic investment in higher education went to the creation of the first 100% foreign-owned university in Vietnam, a branch of RMIT, the Royal Melbourne Institute of Technology in Ho Chi Minh City.
One of the first things we did in Vietnam was a university, and from a green field we had 5,000 students walking in and out of the doors, and that has continued on, and the country has expanded the universities in other country parts of Vietnam.
But it was fortuitous, I think, at the time that we set up a campus here in 2001, and that was when the idea was conceived to come and have a higher education institution and university in Vietnam. Atlantic was around at the time, fortuitously, there to provide, I think, the support that was required to really kickstart this whole project. So that partnership in capacity building has been wonderful, and we see the fruits of that today.
In Da Nang, Huế, Cần Thơ, and Thái Nguyên provinces, grants from Atlantic were invested to improve higher education facilities. A major focus was turning traditional libraries into learning resource centers. A learning resource center is an expanded model of the university library, incorporating computer and telecommunication centers, meeting and conference facilities, language labs, and other accommodations for advanced learning, teamwork, and research.
We put in about, I think, over $80 million to develop 6 key libraries. They had driven in part by Chuck's interest in infrastructure, but ultimately they were about bringing access to knowledge and student-initiated learning to the Vietnamese higher education system.
Before the learning center, our students and teachers have the old style library, and now we have the open stack learning resource center, and all the teachers and students can access to the information easier. They have more IT devices to use, and they have already applied the IT technology in their teaching and learning, especially the online learning.
Một đóng góp không nhỏ của trung tâm học liệu chính là nơi số hóa những cái ấn phẩm văn hóa của cái vùng đất mà có cái truyền thống văn hóa cổ đô.
I'd like to think what we did in higher education in Vietnam with focusing with the learning resource centers and local university and RMIT project has had a significant impact with Vietnam higher education sector.
In the healthcare sector, the need for structural assistance made an immediate impression on Chuck Feeney as he was taken on a tour of hospitals in his first visit to the country.
Chucks want to really look at improving healthcare services in hospitals because that's what he saw was needing at the time, especially these tertiary care hospitals where you see overcrowding, you see crumbling buildings, you see lack of equipment, you see people sleeping on the ground, and then just the whole mess.
There were two buildings. One was German and the other was Dutch. So we looked at that building. So then we came back into the meeting and the director of the hospital and the hospital staff said, well, which one would you like to help us renovate and put back into good operating condition? And he said, well, why don't we do both of them?
Thì tôi cũng nhắc lại, tức là cũng thường nói với cán bộ nhân viên chức bệnh viện Đà Nẵng. Mai đây thì trong cái lịch sử của bệnh viện Đà Nẵng thì sẽ có những cái dòng ngoài cái nỗ lực của lãnh đạo thành phố, của nội lực của anh em chúng ta ra đấy, thì có cái sự giúp đỡ mà rất là lớn, mà phải nói là một cái thay đổi bước ngoặt lớn của bệnh viện Đà Nẵng chúng ta. Đó là vấn đề là được cái tổ chức Atlantic hỗ trợ về vấn đề cơ sở hạ tầng.
As Atlantic learned more about the fundamentals of public health in Vietnam, it became clear that along with upgrading and building healthcare facilities, instilling a culture of public health was critical as well.
The public health deans were telling us, if you're interested in improving health and having an effective impact in a modest period of time, address injury prevention. A bit of a surprise, especially if you're used to building hospitals to deliver hospital-type care. You're probably seeing a lot of injuries coming into the emergency room, but the root cause of that is traffic patterns, traffic safety, and prevention helmets would be a very important part of that. So we very quickly started working with some manufacturers and designers of helmets, as well as health authorities and education authorities to try to change behavior patterns. We were also involved in tobacco control. These are the kinds of things that really are game changers in people's health.
Atlantic grantees worked for many years to get a national helmet law passed, and AP-funded education campaigns were so successful that the day the law went into effect, more than 95% of the people on motorbikes were wearing helmets. It has saved thousands of lives per year and reduced debilitating brain injuries significantly since 2007. Atlantic also recognized that tobacco is one of the main causes of disability and deaths in Vietnam. Working with government and non-governmental institutions, Atlantic has successfully funded a comprehensive strategy to improve tobacco control through legislation and communication campaigns.
Actually, we didn't aim like we have to, in one day we need a law, or in one day we need a tobacco-free and smoking-free area. We learn from the book, and we learn from the grantee and the partner, and we scouting the field, what is the main challenge and the problem, and how to address it, and how to guide the grantee to get there. So very practical, and using the funding, but working in partnership with the grantee.
Major grants also were approved to build capacities for important national institutions, such as the National Hospital of Pediatrics and the Hanoi School of Public Health. The plan for the National Hospital of Pediatrics was to build an internationally recognized center of excellence and a standard setter for pediatric care throughout the country.
Như ông đã biết thì trước những năm 2005 và đặc biệt là kể cả ngay trước những năm 2009 thì cái khoa sơ sinh nó đang rất là nhỏ bé, chỉ có 25 giường và chỉ có 25 giường bệnh, và cái số lượng trẻ em đến nằm tại bệnh viện là đến những là 70, thậm chí có lúc lên 100. Thế nhờ cái sự giúp đỡ của tổ chức AP thì chúng tôi có một cái tòa nhà mới gọi là 4 tầng với 200 cái giường bệnh sơ sinh ở đó, thì đã giải tỏa thứ nhất là khi trẻ em đến khám và chữa bệnh, trẻ em sơ sinh đến khám và chữa bệnh tại bệnh viện.
At Hue Central Hospital, Atlantic funded the creation of a new cardiology center that quickly moved to the forefront of heart surgery in Vietnam.
Đây là một cái công trình hoàn chỉnh đầu tiên về mô hình về trung tâm tim mạch tại Việt Nam. The first model cardiac center in Vietnam. Và dấu ấn tốt nhưng quan trọng hàng đầu đối với trung tâm tim mạch. Thì chúng tôi thực hiện một cái ca ghép tim đầu tiên ở Việt Nam và tại trung tâm tim mạch. Và sự kiện này là đưa Việt Nam vào trong danh sách bản đồ ghép tim của thế giới.
With this focus on national institutions for public health, a more unified national healthcare system was in development. It was at this point that an opportunity to build upon this culture of unity emerged.
And the trick was to try to find a niche, a space that Atlantic could fill and contribute to a system-changing approach to healthcare in Vietnam. And that niche was really focusing on primary healthcare.
You know, there are good people in the structure, if you look hard enough, and they're everywhere. And many of them toiling away, you know, without any attention from the outside, and they keep doing things that they have been doing, trying to help their community. It's those people that we're trying to help. Those are the people that we want to empower, to unlock their potential so that they can do better, and to change the system from within.
In the provinces, the emphasis on primary care took Atlantic into the commune health centers, which was an important place of entry for healthcare. There was a significant amount of work to be done because the structures were dilapidated.
It became clear to us, though, that to be effective in delivering health services, we were going to have to address the health system and emphasize opportunities to get those health services out into the community and focus on primary care. And so the development of community-based health centers in Vietnam was kind of a marriage of the two, creating some facilities that would house the delivery of community-based primary care services, a marriage of our predilection for bricks and mortar with our focus on human resources and community-based primary care.
When I first met with the provincial health director in Can Hoa, for instance, Dr. Min, at that time, we start to ask ourselves, how do we address this problem, improving primary health care? Without a facility to work in, nothing can be done.
Together with the provincial government, Atlantic helped to fund the construction of more than 800 commune health centers in 8 provinces with a population of 8 million people with a total investment of more than $80 million. The goal was to create an integrated model from rural commune health centers to urban hospitals, with the hope that the government would implement this model in other provinces.
Nói đơn giản như vậy, trong lĩnh vực chăm sóc sức khỏe ban đầu, chúng tôi có những dự án nâng cấp cơ sở, trạm y tế, trang thiết bị cho cơ sở đó. Ngoài ra chúng tôi có những cái hỗ trợ để nâng cao năng lực của cán bộ y tế công tác tại tuyến cơ sở. Tại vì người ta phải có nâng cao năng lực như vậy, người ta mới có thể sử dụng những cái phương tiện vật chất và trình độ của họ có cao như vậy thì họ mới có thể nâng cao cái chất lượng chăm sóc sức khỏe cho người dân địa phương. Đó là một việc.
Tình y tế tại Thừa Thiên Huế vào trước khi mà cái dự án của AP được triển khai thì chúng tôi cũng gặp rất là nhiều khó khăn, đặc biệt là về cái hệ thống y tế cơ sở, mà trong đó là các cái trạm y tế thì hầu hết là các cái trạm y tế của cấp 4, xây dựng theo cấp 4, và cái đội ngũ bác sĩ cũng rất khó khăn. Rõ ràng ra với cái xây dựng các cái 100% là các cái trạm y tế là 2 tầng, trong đó là một nửa 50%, trong một số tổng số 152 trạm thì là 50% trạm y tế là do AP là xây dựng.
With quality facilities and trained staffs in place, Atlantic turned its attention not only to tending the sick, but also to developing programs to serve the most vulnerable segments of the population. A key example was a program for mothers and infants, which brought together the best efforts of Atlantic, a partner NGO or non-governmental organization, and government at both the local and national levels.
Đây là một cái điểm mà không phải riêng về Atlantic hay là Save Children, mà của chính quyền địa phương, mà thậm chí của cả Bộ Y tế Việt Nam đều tâm đắc về cái điều này. Bộ Y tế Việt Nam đã dung nhập được cái ý tưởng và đã cho thực hiện một cái chương trình lồng ghép trong cái chương trình mục tiêu quốc gia để mà xây dựng những cái đơn nguyên sơ sinh ở bệnh viện huyện và đào tạo khả năng cấp cứu sơ sinh cho nhân viên y tế ở tuyến phường xã.
Once the first commune health center was built, the next one and the next one, and the training took place, the successes came rapidly. And before long, the whole province was covered, and then other provinces started taking notice, and it just snowballed. And I think that was the best feeling for me, to see all this taking place in real time.
Fong and Gwyn and Dr. Howe and their team are really unique individuals, and we've been lucky to be able to find them and for them to agree to be part of this undertaking. Without that kind of staffing, without that kind of leadership, these programs can't take hold, can't be developed, can't be sustained.
We're lucky to have many generations of the leadership of the Vietnam who learning from the past, of the culture, of the story, who are very sensitive to the new development in the world, who are following very deeply the peaceful feeling and compassion of Vietnamese culture. Still so many to do, so many challenges to do. But we are very determined to go away with these dreams, to make this country better in economic, in culture, in social life for all the people. And for our way going ahead, we need such people like Jack Finney, such organizations like AP to go together with us.
Since 1997, Atlantic Philanthropies has invested $381.8 million in improving higher education, public health, and primary health care in Vietnam. Since 2003, the focus of the grants has been on improving the primary healthcare system while instilling a culture of public health nationwide. And what are some of the outcomes? Fewer deaths due to motorbike accidents, better functioning hospitals with improved patient care, 6 modern collegiate libraries, and, at a particular point in time, 800 community-based primary care centers, 10,000 open-heart surgeries, 15,000 cardiovascular interventions.
And so we have been very successful up to now in many of the initiatives that we started. Injury prevention, primary health care, mental health, social work, tobacco control. These are issues that our staff and our collaborators inside and outside of the country have been very successful in getting started and getting right the sustainability aspect of it. We have this desire to continue to work to help improve Vietnam healthcare system, and we will.